It's hard to find bridge players, but we have an interesting group of girls.
How are you feeling?
We play on New Year's Eve here. And I wasn't going to do it this year because I felt so rotten.
I think I'll pass.
When you get a certain age, you're supposed to take what comes and be happy and thankful. I wasn't as thankful until I realized how lucky I am.
You gotta take turns. I like you.
I had no symptoms until I was about 87. I started having this when I was going up and down the stairs, I couldn't breathe. See, that's why. Then I got lightheaded, and I got terribly, terribly tired. Years ago, my doctor said, live with it. It was not living. It was existing. I like the fact I'm independent, and I ask very little of my kids.
Isn't that nice?
If I can do it myself or get it done, I do. I really thought I was going to go away until I was laying on the steps and I knew that that wasn't going to go away, that something had to be done.
Too much left here. Morning.
There are some patients who simply want a chance at feeling better, and Ms. Vaughn was one of those. She had persistent symptoms, and the symptoms just were not getting better. She had a problem with her mitral valve that could not be treated with medicines.
It got worse.
We found out what was wrong, that this valve is not working properly. And
These two leaflets are meant to come together like a pair of doors. When they close, they're supposed to touch. This mitral valve is allowing blood to move backwards.
But you gotta face facts. I am old. I don't think my body would take surgery well at all.
Hey guys.
What I told her was that open surgery was not recommended for her because of her age and the risk of the surgery. And it was very apparent to us that she was somebody who we should treat with the MitraClip therapy.
That's right.
A patient needs to be seen by a surgeon and a cardiologist together.
Comes packaged like this.
There's a large population of these patients that are not good surgical candidates. And a lot of that age plays a role into it. And so, that increases our risk exponentially.
That's great.
One way to remove that risk is through a therapy like MitraClip.
Our goal is to go in there and use that clip to help put those two leaflets together. Are you ready to get this done? Okay.
And he said, don't worry, you're in good hands. It's a good crew.
So here's our room. Everyone has concerns about an elderly person having the procedure, but the procedure itself is so well tolerated. It doesn't require going on bypass. The procedure is performed using access through a small vein in the patient's leg. I think we're ready to go in and try to grab. This leaky valve causes pressure to build up, and that high blood pressure in this chamber then leads to heart failure. So this is the MitraClip. The clip is inserted into the patient fully closed. We then cross into the heart and use the clip arms and the grippers to then grab the mitral valve leaflets. We close the arms together, and then that's how we create the MitraClip implantation. Okay, cool. It then turns a valve that has a leaking problem into a valve that now the leaflets come together. When we're done, that tube is removed and it's closed with either 1 or 2 stitches. Congratulations, everyone. It looks fantastic. Leaky mitral valve has completely been treated with placement of this clip and would not cause any symptoms of heart failure. Congratulations.
It worked.
It worked. Those pressures in your heart were life-threatening.
Holy. He was standing there smiling from ear to ear, and I knew it had gone really well.
Just generally feeling better, and,
Okay.
and it feels lighter there, like something was lifted off my chest.
Fantastic. She had the procedure done within about an hour. Within an hour and a half or so, she already had the breathing tube taken out and was already awoken and was starting to recover at that point. I'll see you in the morning, okay? Overall, she was actually home about 48 hours after she came in for the procedure.
He had said I would feel better, and I did. That's the difference. I'm living now. I'm doing anything and everything I want, going where I want. I do things differently now. I am doing yard work where I wasn't doing it. If I hadn't had the procedure, I'd have ended up in a nursing home. see how many times I go up and down the stairs?
Oh my, she's just showing off.
I'm just glad I'm still in my own home and I'm driving at 90, so it can be done. I'm a very lucky young lady, or old lady as you want to put it, and I feel very special. I really do.